As doctors and scientists, our goal and our role is to provide information to families. And human genome information is the most important information. It provides a window into the past, the present, and the future. The Hospital for Sick Children is commonly known as SickKids, and it's one of the largest pediatric hospitals in the world.
To that, we have been able to establish collaborations within Toronto. We are working with UHN and the University of Toronto, and we have been able to establish collaboration with industry, which these days is more and more important.
70% of the children who come to this hospital have some form of a genetic disorder. And we have a long history of genetic discoveries coming out of SickKids Hospital that have been based on studying the populations that come here.
Several years ago, we realized that the revolution in DNA sequencing technology, when combined with the explosion in our knowledge about how genes affect human health, were creating the ideal conditions for changing the practice of medicine. We saw this as an opportunity to not just improve diagnostic testing, but to create a new clinical paradigm, and that's the paradigm of genomic medicine.
We are really trying to focus on the individual much more than we ever have. And it's really almost a philosophy change we would like to implement here at SickKids, where we have to train even our more senior physicians as well as the new trainees to think that way and not try to put people in a box anymore. And the information we gather from genomic DNA is exactly the vehicle we need to implement this individualized medicine.
We designed the Center for Genetic Medicine as a multidisciplinary infrastructure that would bring together from across the hospital
the clinical division,
the program where we do the research in genetics and genomics.
We have our genetic counseling program,
the diagnostic laboratories,
non-geneticists and bioethicists,
all under one hub.
So we all work together towards the same cause.
To develop this new discipline of genomic medicine. And the center has a number of projects, both short-term projects, but also long-term exploratory research.
When I started practicing genetic medicine about 12 years ago, we were very limited in providing answers to our families. And that has really changed over the last 3 to 4 years.
Zara's case is typical, I guess, of many of the children that come to see us in genetics, because parents are looking for answers, and often they and their children have been through multiple tests and nobody has been able to tell them exactly why their child has a physical or a developmental difference.
My daughter has been diagnosed with an ultra-rare condition called PCAN that falls under the umbrella of NBIA, that's neurodegeneration of brain iron accumulation. I think it is comforting in one way to know that, what the diagnosis is, how the symptoms affect the patient, because it gives me an opportunity to do whatever I can possibly do in terms of helping my daughter and finding a solution, whatever is available out there.
I think the unique opportunity we have here at SickKids is being able to immediately investigate the impact of what we're finding.
Genetics is not just critical for patients who have rare diseases and rare anomalies, but it really plays a role in the entire pediatric hospital at SickKids, and that is one of our most important philosophies. We are branching out into the entire hospital and have now collaborations with almost every division in this hospital, because genetic affects so many children in every aspect of the hospital.
One of the remarkable features about genomic analysis is that it can not only allow you to diagnose the disease you have today, but can also predict what diseases you might develop in the future. And I see this as an aspect of genomic medicine that is a tremendous opportunity to turn genomic data into clinical knowledge and improve health.
The goal ultimately is actually to sequence the genome of every child that comes into the hospital, to use it for perhaps confirmatory diagnosis, surveillance, or in a predictive manner to help inform on lifestyle decisions for those kids and families.
It's in a really exciting era to be in right now in medicine, And I think genomics is going to permeate all pieces of health, and I'm just kind of really happy to be part of that sort of movement and be at the forefront of it.
In terms of reality, the future is uncertain, but in terms of hope, yes, there is hope.